So my name is Jung Jae-jun from Student Nurse in AUP. Today I'm going to present about the starting and monitoring intravenous infusion and also intravenous therapy with volumetric infusion sets. And for lastly, I'm going to do the remove or discontinuation of infusion sets. Thank you. So here I'm going to present about intravenous infusion with a normal infusion sets. So first of all, always sanitize hands for the hand hygiene. And I have normal infusion sets. And I have saline solution. And I have tape. And I have scissors. And I also prepare this information card. And I'm going to put it on the saline liquid. There we go. And always check if there's a broken part or not. If not, just open it. There we go. And before, lock it. Lock. And if you're ready, insert it in the saline plastic bag. Always remember not to touch this part. Remain clean. Gently twist it and there we go. And I'm going to squeeze this part to fill up half of the. There we go. So what I'm going to do is to remove the oxygens from the tubing slowly. And there we go. I removed all the oxygens, and I'm going to also remove the bubbles. Slowly, not too fast. And there'll be some liquid coming out. And I'm not going to remove the cover yet. And once removed all the oxygens and the bubbles, insert it to the patient where and of course we need to put tape on it so that it will not move. There. So here we're going to do this is 100 milliliter with hour and 40 minutes. So this is 1 milliliter is equals to 20 drops according to the infusion set. Yeah, 1 milliliter equals to the 20 drops. So I'm going to count 20 drops in 1 minute. There we go. So for now, I'm going to start an intravenous infusion through a volumetric chamber, volumetric infusion set. So here's my hand hygiene, and here's a normal saline here, and here's the infusion set, and here's a tape and scissors. So I'm going to open the infusion set. And I'm going to lock so about 20 millimeter. And I filled it, and there's some bubbles and the oxygens. I'm going to remove all the oxygens and the bubbles. And some solution may come out. Remove all the oxygens and the bubbles in the tubing. And make sure I'm not going to touch the rubber part. There we go. And I can see the bubbles going up. There we go. So this is my intravenous infusion, the volumetric set. So for now, I'm going to present discontinuing an IV infusion. So first of all, introduce and explain the procedure to the clients. Hello, Mr. Justin. I'm here to discontinue your intravenous infusion, and already doctor told me that your medication is complete. So here I'm going to discontinue your IV infusion. So prepare for the cotton ball with the wet and put it on the tapes to remove easily, and be careful with the especially the hairy patients. And once you're done putting wet, prepare a dry cotton ball and do not put pressure on it, and we remove the tape and put pressure on it. And your wrist, make sure before removing, close the infusion set always. So here we go. Thank you. This was my discontinuing intravenous infusion. And for the catheter, always do not let the catheter touch others or poke others. Thank you. So after doing all of this, ask clients about the comfortable. So I'm going to ask. So, Mr. Zhang, were you comfortable with my discontinuing, or may I ask you any uncomfortable things, or is there any? Do you feel any problem? Oh, thank you. And here's one more important thing to do is to clean and dispose all the used materials after the injection, I mean intravenous infusion. Thank you.